Listen carefully to your body. If you simply lie down on your bed and feel tension in your leg, if you cannot move your leg to the side, cannot bend it, and feel pulling along the inner thigh, then I have some bad news for you. Your iliopsoas muscle is literally crying out for help. In this video, I will show you an exercise that helps relax this muscle and live without pain. First, I want to explain what this muscle is and why it hurts. This muscle is called the iliopsoas muscle. It is activated with every step you take while walking. It also works when you rise from any surface and when you sit or lower yourself down. Its work usually goes unnoticed, but once it loses its proper function, the entire body immediately reacts. The musculoskeletal system begins to function differently. When this muscle goes into spasm, it restricts movement in the hip joint, especially when moving the leg outward. To determine whether this muscle is spasmed, simply lie on the bed and try to move your leg to the side. If you feel tension along the inner thigh, this indicates that the muscle is in spasm.
Now let's understand why this muscle begins to suffer, becomes tense, and cannot relax. When certain disorders develop in the cartilage tissue or joint capsule of the hip joint, the brain activates compensatory protective mechanisms. Their purpose is to limit movement in the hip joint. Less movement means less pain. However, if the muscle remains tense for a long time and does not relax, it gradually shortens. Because the flexor and adductor muscles in our body are stronger than the extensor and abductor muscles, a flexion-adduction contracture of the hip joint begins to form. As a result, a person may feel not only shortening of this muscle, but also an apparent shortening of the entire lower limb, along with restricted hip movement. How can you determine at home whether one leg has become shorter? Undress down to your underwear and stand in front of a mirror so you can see the position of your shoulders and pelvis. Pay attention to how comfortable you feel standing. If you level your shoulders and pelvic bones but feel discomfort, place a small book under the foot of the leg you believe is shorter. If standing becomes comfortable and your legs visually align, you can estimate how many millimeters or centimeters of shortening are present.
Also, look at your shoulders. If one shoulder is higher than the other, this indicates that your spine is compensating for the difference in leg length, leading to deformation in the lumbar spine. This, in turn, causes a chain of problems throughout the musculoskeletal system. If you notice shortening of the leg, there is no need to panic. You should undergo an X-ray and consult a trauma and orthopedic specialist. If no defects are found in the acetabulum or the femoral head, then the issue is caused by contracture, specifically muscle spasm in the hip area. It may seem like a minor issue involving just one muscle, but the entire musculoskeletal system suffers. When this muscle spasms, hip joint mobility becomes limited, and compensatory mechanisms overload other joints and the spine. What should be done to relieve the spasm at an early stage? You may use non-steroidal anti-inflammatory medications, such as ointments, creams, or tablets, to reduce inflammation and pain. You can also visit a massage therapist, osteopath, or manual therapist to relax the muscle. However, it is important to remember that a tight muscle is only a consequence, not the root cause. The real cause lies deeper. For this reason, you need to consult an orthopedic traumatologist and undergo diagnostic tests, such as MRI or X-ray, to determine whether the problem originates in the joint or the lumbar spine. Only then can an accurate diagnosis be made and proper conservative treatment started. Timely consultation with a qualified specialist is essential. You can book a consultation with me using the link in the description below this video, and together we will find the true source of your pain.
As promised, here is an exercise to gently relax and stretch the iliopsoas muscle and improve mobility in the hip joint. To perform the exercise, stand upright, move your right leg backward, and place it on your toes. Pull your abdomen in, keep your back straight, raise your right arm, and rotate your pelvis forward. You will feel a gentle stretch along the inner thigh. This is the correct stretch of the iliopsoas muscle. To enhance the effect, slowly lean to the left toward the supporting leg. You should feel a stretch from the pelvis up to the ribs. Hold this position for 15 seconds and breathe evenly. Then switch legs and repeat the exercise on the other side, even if it does not hurt. This exercise is a temporary solution.
Massage therapists, manual therapists, and osteopaths can relieve muscle spasm and treat the symptoms, but the underlying problem is usually deeper, within the hip joint itself. That is why it is essential to identify the true cause and understand where the problem originates. Conclusion. Subscribe to the channel. I share a lot of valuable information about musculoskeletal health. See you in the next video.